Hey all you awesome viewers, I am the funguy who is actually a fungus, and this is the Stupicide. Today, we are going to be covering the COVID-19 vaccine. Probably all of them, but I think particularly the AstraZeneca. There's been a lot of misinformation circulating about this vaccine, and people don't seem to understand that, you know, it's important that as many people as possible get this vaccine in order for us to get through this pandemic as easily and as effectively as possible.
Numbers of infections in this country are going down.
Vaccines have been tested rigorously.
Most COVID-19 vaccines have gotten through this process a lot faster by overlapping the different phases of human trials.
It is impossible to get the COVID-19 virus from a vaccine.
Get the jab or give up their job.
And maybe more importantly, a 93% rate among the most predominant variants of the virus that are out there.
We're now on track to have enough vaccine supply for every adult in America by the end of May.
Do not come. Do not come.
I'm gonna come.
And everyone fucking cheers. Oh my god, I love it. Let me start this off by saying, I too used to be an edgy 15-year-old who believed that vaccines did literally nothing and only got you sick. It wasn't until I grew up and started getting the flu vaccine and the COVID vaccine that I realized, hey, those vaccines didn't get me sick. They made me feel like I was getting sick for like a few days to a week, which is what vaccines do. But guess what? I was vaccinated. You know, my parents had the common sense, the knowledge, the foresight to get me vaccinated. And that's why I'm alive right now, okay? The vaccines that we're using for COVID-19, you probably know this, and if you're an anti-vaxxer, you probably use this as one of your points, is that it's a relatively new technology. It's a relatively new type of vaccine. However, it is a safer type of vaccine, and it is just as effective, if not more effective. I don't know which it is, but it's at least as effective as previous vaccines. Not only that, it's being used as a model to create vaccines for, like, HIV. A vaccine for HIV, not just medication to suppress it. That's groundbreaking, and it's all because of the work that they did to get the COVID vaccine out and all of the studies that they did for this mRNA type of vaccine. It's amazing! Not to mention getting the COVID vaccine out in record time. Oh, kinda sus, bruh. Kinda sus. Are you kidding me? It was properly tested. All of the clinical trials went through and were completed. The only thing that was removed was the red tape, the bureaucracy that would have made it years and years to get the vaccine out. Because guess what? It was a state of fucking emergency for the world. It is one of the most impressive feats of the scientific community, probably ever. People are like, oh, I don't know, that's kind of suspicious that the scientists did such a good job in Clutch. Like, seriously? Be proud of the fucking technology that we have. Be proud of science. So first we're gonna go over how viruses and vaccines work. Then we're going to go over myths of the COVID vaccine being debunked. And then we're going to do more of a dive into whether or not the vaccine causes blood clots. By the way, already, newsflash, the virus itself causes way more likelihood of dangerous blood clots than the vaccine ever does.
But unlike typical vaccines, which introduce inactive or weakened forms of a virus, these will release genetic material called messenger RNA. So what exactly does this mRNA do? Well, in a regular cell of your body, you have DNA inside of the nucleus. And this DNA stores all the information and instructions important to the functioning of your cells, your body, and ultimately makes you, you.
This is all basic science, by the way. This is all like basic biology. I learned this stuff in like, I want to say early high school. I learned about like DNA and genetics.
Your cell is machinery that reads through your DNA and transcribes it into mRNA, which then leaves the nucleus and goes into your cytoplasm. And it's here that the ribosomes in your cells read the RNA and, depending on the specific code, build a series of amino acids which fold in on themselves to make proteins which keep you alive and functioning. This process is known as translation. In fact, it's this process that viruses take advantage of in the first place. They insert their own genetic information into you, and then your cell machinery unwittingly starts taking that information and building proteins to help create more viruses.
So that's how viruses reproduce. Like, again, very, very basic knowledge that I think most people know.
But in this case, it's only coding for one small part of the virus, instead of the whole thing. You've probably seen SARS-CoV-2 represented like this,
the spike protein,
with the spikes on it. And it's this spike protein, which on its own is harmless, that the vaccine's mRNA codes for. The mRNA makes its way into the cytoplasm of your cells, where the ribosomes read the information and start to
It's not even the part of the virus that you're getting in the vaccine isn't even part of the virus that can reproduce. It's just, I guess it would be similar to taking something that smells like something, that smells like someone, and training your dog to get super aggressive when he smells that particular person. Then if you bring that dog around that person, they're gonna go nuts.
Is it safe? And given that it's a relatively new technology, should you be concerned at all? Well, that's what these initial trial stages have been for, not only to test whether or not they work and cause immunity, but to make sure they have minimal side effects. As of now, around 70,000 people have been given these vaccines with no serious concerns.
What's that? They actually, they went through the clinical trials. For those of you saying that they didn't conduct clinical trials, they didn't experiment, I'm sorry, but you're wrong. I don't know where you're getting your information from. Only the bureaucratic red tape was taken out.
It's not unlike going to the gym and getting exercise and really sore muscles. A bit of pain can be a positive sign that good things are happening. Sometimes you have to earn your immunity, just like you have to earn those biceps you wanted so bad.
Getting a little sick or feeling like a little bit like crap after taking a vaccine. A tiny, tiny, tiny price to pay for immunity. Not dying. Much, much, much less chance of spreading it. Let's take a look at Simon Dan, the truth about COVID vaccines. I love this guy.
Today we're going to focus on the COVID vaccines, explaining just what they are and how they work. And whilst we're at it, we'll address some of those silly theories that are being bandied around at the moment. Some people have had some serious reservations about these COVID vaccines, which, let me get this straight, is fine. But what I want to do today is alleviate some of those genuine worries, as well as deal with those silly theories as well. So let's start with one of the most common concerns regarding the COVID vaccines, and that is the speed in which it was produced and approved for use. Under normal circumstances, there is a process for developing a vaccine. A preclinical stage which looks at how the vaccine will work, what antigens they're looking to produce with the vaccine, and what is the best delivery method. This stage usually lasts 1 to 2 years. However, with the COVID vaccine, we have to remember that the coronavirus was already a well-established virus, which we knew a lot about. There are 7 types of coronavirus that circulate around humans. 4 of them cause very mild symptoms and are relatively harmless. The other 3 are SARS, MERS, and COVID-19.
People keep forgetting the COVID and SARS are related, and MERS also, which I didn't know until I watched this video. We already had a lot of information about COVID-19 because it was the same kind of virus as several others that have been around for a very long time.
Usually, the whole clinical trial process can take up to 6 years. However, with the COVID vaccine, you have almost an unlimited supply of people that are infected with coronavirus to test this on, and a pretty much limitless pot of money. Not to mention the incredible pressures from the governments of the world. You can easily see how this can now be done in a matter of months, rather than a matter of years if we take all of that into account.
We have all of this information on coronavirus and other viruses that are extremely similar, basically the same. We have an unlimited number of people to participate in clinical trials, and we have basically a shit ton of money because this is priority numero uno for the world pandemic. And yeah, the pressures of the people in charge saying, please get this working soon. Please get this working soon. Our economies? No. Our economies? No. No. Everything is just no. Please, scientists, nerds, help us.
However, I must stress, the COVID-19 vaccines would not have been approved if they weren't safe or effective.
Very, very true. Very, 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 very true. The CDC or the FDA, they're not going to approve mass quantities, and in some cases, well, probably all cases, mandated vaccinations of something that is harmful to people. The CDC and the FDA do not want people to die. That is why they exist.
Now, I've seen quite a few people state that microchips are being injected into us with the vaccine, which was possibly an idea by Bill Gates. Now, microchips certainly are small enough to fit into the vaccine. IBM, for example, have made one that is only 2 nanometers long. However, when the doses of the vaccine are taken from the vial, I think there's around 4 doses per vial, how can the administrator of the vaccine guarantee that each dose is getting 1 microchip? Also, you've got to consider the cost of this, with over 1.9 billion vaccines given so far.
Microchips are really fucking expensive, especially ones that could fit into a vaccine. Why would they spend all of that money for no reason? Literally no reason.
Fetal lines are not fetal tissues, and as I stated earlier, they are not part of the actual vaccine. They were only used in the development of it. Finally, I'm going to take a look at one of the recent crazes going around, which is where people are putting metallic objects on the injection site of the COVID vaccine, claiming that the person injected is now magnetic. And how is it magnetic in the first place if there's nothing magnetic within the vaccine? Plus, more people that have tried this have failed to make something magnetic stick to their arm than succeed.
Yeah, it's kind of suspicious, you know, when a fad happens and most of the people can't replicate that fad. Maybe that fad is fake then? Alright, now we're gonna do some research on blood clots. Before I do this, I do want to say that if you perform a quick Google search, COVID vaccine blood clots, and what do you get? Can blood clots be a complication of COVID-19? Some COVID-19 deaths are believed to be caused by blood clots forming in major arteries and veins. Blood thinners prevent clots that have antiviral and possibly anti-inflammatory properties. This is from WebMD. What are the side effects of the Pfizer vaccine? Side effects that happen within 7 days of getting vaccinated were common, but were mostly mild to moderate. Fevers, chills, tiredness, headache throughout the body were more common after the second dose. Alright, that's from the CDC. Common serious adverse events, I guess effects. Okay, again from the CDC. The most serious adverse events in the vaccine group were numerically higher than in the placebo group, where appendicitis, 7 in vaccine versus 2 in placebo, acute myocardial infarction, 3 versus 0, and cerebrovascular accident, 3 versus 1. That's interesting. And that's also in the Pfizer. That doesn't seem very high. Yeah, but I mean, the main point is it dangerous? Severe? Grade 4. Severe. Worthy of hospitalization. No. 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 Look, it's not dangerous. Huh. Nothing for blood clots, huh? Interesting. I wonder why blood clots wouldn't be listed. Perhaps it's so abysmally rare that it's not even worth putting on a list like this? It just says some deaths are believed to be caused by blood clots, so it's not even that common if you have the virus. It's just, where did this come from? What, out of all of the things, why couldn't you have picked a symptom that is actually, more common? Not like abysmally rare that it doesn't even warrant being mentioned? New study reveals the virus triggers production of antibodies circulating through the blood, causing clots in people hospitalized with the disease. Oh, look at that! You can get blood clots from COVID. Interesting. The culprit: an autoimmune antibody that's circulating in the blood, attacking the cells and triggering clots in arteries, veins, and microscopic vessels. These clot-causing antibodies are typically seen in patients who have the autoimmune disease antiphospholipid syndrome. Okay. So you can't even... You don't have a good chance of getting blood clots if you have COVID unless you have antiphospholipid syndrome. So again, more risk getting blood clot when you get COVID than you ever would have if you took the vaccine. Another reason to take the vaccine.
Lastly, the number of very rare type of blood clot called CVST, which is a blood clot in the brain, cerebral venous sinus thrombosis, was higher than they were expecting. It was also associated with something called thrombocytopenia, which means low platelet counts. Your platelets are basically cells that form a mesh when you bleed to stop you from bleeding. There's been no direct causation with the vaccine, however, they have...
Yeah, if you ever look at a scab, well, that whole scab is basically platelets. Out of 18 million vaccinated people, 22 had CVST, the blood clot that he's talking about. 22 out of 18 million! That's 18 millions! Out of that, 22! 22 people had a blood clot, and 7 people, unfortunately, did die. But the fact of the matter is, that's still an abysmally low percentage of people.
Look, with any mass rollout, whether it's a medication like a tablet or a vaccine, when you're giving it to like millions of people, there is no scenario where everybody will be absolutely fine. I know no medication that has no side effects, that has no adverse effects. Even things like paracetamol will have people who are allergic to it or have problems with it. That unfortunately is modern medicine. We have to try.
That is another thing, is someone might be allergic to something that's in the vaccine, and that can contribute to it. But usually before the fact, you can figure out whether or not that person is allergic.
A tablet that we commonly use, let's just say metformin. We give it for diabetes, type 2 diabetes, helps people reduce their sugar levels. It also helps them reduce weight, and it's a fantastic drug. But it does have side effects, and one of the rare side effects is lactic acidosis. It's about 3 to 9 patients every 100,000 patients, and it can be fatal if they get that condition.
But here's the thing. Would you then not take the insulin if it meant that there was a tiny chance that you would die from it? Probably not, because you need that shit to live.
We know the real damage that COVID does. So if we don't vaccinate people, hundreds of thousands of people will die. Probably millions will have something called long COVID, which we're only starting to understand.
I thought he said long COVID. What the heck is long COVID? These so-called COVID long haulers or sufferers of long COVID are those who continue to feel symptoms long after the days or weeks that represent a typical course of the disease. Look at that! Even more reason to get the vaccine! If you happen to get COVID, you might get COVID for a long ass time! Holy shit! Get the fucking vaccine! Is persistent symptoms or new symptoms that develop, generally speaking, at least 4 to 8 weeks after the initial infection with COVID-19. All sorts of symptoms from head to toe that can either persist or develop somewhat newly after they're infected. Group of patients follow different time courses. Some people, not uncommonly, are very slow to recover, and it takes them 3 to 6 months to get back to feeling like they have their normal level of energy and that their breathing is improving. Others are 9 or 12 months out from their infection. So, 3 to 6 months just to start feeling like you're getting better. Some people have been feeling these symptoms for a year, and there's no sign of improvement. Do you want long COVID? Huh? Do you want that long COVID dong deep inside of you? No? Then get the little prick. Okay? Get the little prick inside of you, and you won't have to take the big daddy dong. Alright?
Hey everyone, thanks again so much for watching. If you like what you see, hit that like button, and click on my mushroom face to stay up to date with all my videos. If you didn't like it, go ahead and hit the dislike button. Why not? If you have any suggestions for content or just want to say hi, leave a comment, but keep it classy. That's it for now. See you next time.
Okay, get the little prick inside of you.